Welcome to Physician Focus. I'm Dr. Linda Young. The issues children face growing up today, as viewed through the eyes of their parents and other adults, are vastly different than those from just a few years ago. The C.S. Mott Children's Hospital of the University of Michigan Health System conducts a national poll on children's health every year, rating the big problems in children's health as perceived by adults. This edition of Physician Focus will review the top 10 major health issues facing our children as reported by this poll. We'll examine such questions as why adults view these as the biggest problems. Are they different from those that pediatricians see as major issues? And how do pediatricians counsel parents and their children on the biggest threats to their health? With me for this discussion is Dr. Elizabeth Goodman. Dr. Goodman is a board-certified pediatrician and subspecialist in adolescent medicine. She is Associate Chief for Community-Based Research at Mass General Hospital for Children in Boston, a professor at Harvard Medical School, and a member of the Board of Directors of the Massachusetts chapter of the American Academy of Pediatrics. Welcome, Liz. Thanks for joining us.
Thanks, Linda. It's great to be here.
So we have this poll that we have looked at and that you have seen, and we've seen these issues. And what do you think? What do you think about those perceptions that adults have? What do you think the poll really says?
Well, you know, I wasn't surprised to see these issues reflected in the poll because the C.S. Mott Hospital has been doing this poll for a number of years now, and they've been asking adults what they feel about these issues for years. So it wasn't surprising. In fact, I think these are all important health issues for today's children. You know, whether or not these reflect what you and I as pediatricians think of as major problems for children's health, or even if you asked adults of children of different ages in the streets, what's the biggest concern for their child, I think we might see some different things.
I totally agree with that. So how do you think some of these issues, how do you think they're influenced? Do you think media has something to do with it? Do you think just a parent's opinion? And I know some of the people that answer the poll are not parents, so it's kind of interesting that that mixes in there.
Right.
So what are some of the factors that you think influence the way parents will rate the problems that they see for children?
I think you hit the nail on the head when you mentioned media. You know, many of these issues are what we've been hearing about week after week, night after night on the news. They're reflected in the press and in many press reports. So childhood obesity, which has been a big problem for a number of decades now, you know, that's something that we hear a lot about in the press, especially around back to school time when people are thinking about school lunches and how to feed their children at school. So these are issues that have been front and center in the press, and I think that shapes adults' opinions.
Yes.
And again, these are adults, not necessarily parents. So I think a lot of them, particularly adults who don't have experience with children, they're taking this through the eye of the media.
Yes. The other issue, I was just thinking, the back to school issue is when the parents go and buy new clothes for the children, and they'll say, oh my gosh. And so I think that it's personal experience. I think there's a lot of issues here that would make me respond to a poll from what I hear and what I read about in the media or what I've experienced. So we're going to put the poll up so that people can see it, and we know what the poll is because we have it in front of us here. So what do you think of any of these ones? Which are the ones that you'd like to pick out and go a little bit further on? You mentioned the obesity one, which we can go further on.
Well, I think one of the most interesting things for me is that most of the issues that were raised here reflect issues for adolescents.
Yes.
So, you know.
So adolescents, what ages would you consider an adolescent?
Well, people may be surprised, but in the Society for Adolescent Health and Medicine, we talk about ages 10 to 24. So
big age range.
Earlier than many people think and later than some people think.
Yes.
But for one of the major problems on the list is not an adolescent problem, it's a problem for children of all ages, and particularly for young children, and that's child abuse and neglect, which is a really important issue to be addressing for children of all ages.
Yes, definitely. And as I look at this too, I realize that's probably one of the major, or the major one on this list that applies to all ages, and it's nice to see it there. But the other thing that I had looked at and said, wow, there's a lot here on social media.
Yeah.
And how you can look at bullying, also cyberbullying, that sort of thing. So what do you think as far as the one thing that we had looked at was that the number 6 one on here, sexting, has moved up significantly from previous polls. So what do you think's going on with that?
Well, this might be a good time for us to take a step back and talk about that movement and the rankings and the polls and what that means. Because this is a list, but it's a list with a rank attached to it. And we're hearing a lot about polls and numbers and rankings, particularly in our current political cycle. So people are familiar with that. And when it comes to schools, here we hear a lot about school rankings. And so it's a concern for people. Where do these things fall in the ranks? But if you look at the differences in terms of the actual proportion of the adults who think that these are big problems, they're all pretty similar, you know, in the mid, like high 40s to 50% ranges.
Right.
So the exact number, I don't think, is really as important as whether or not people view these things as an issue. And again, we have to remember that adults are being presented with a list of issues and asked, you know, how big a problem do you think this is? And I think it would be hard for any adult to say, bullying's not a problem. Right. Drug abuse is not a problem. I mean, if somebody came up to you on the street and said, do you think child abuse is a big problem? You would probably just say yes.
Yeah, I think so, yeah.
No matter what you thought, right?
Yes, yes.
So whether sexting moved up from 13 to 6 and what that means, I'm not really sure what that means. But
right.
I think your point about social media being a concern for people is really important.
Yes.
And is a major issue facing children and parents in terms of how they negotiate their lives in this 24/7 type of world.
Absolutely, and we're going to expand on a little of this as we go on. And then the other thing too is drug abuse. I think that a big issue, and it's become a bigger issue recently, and I think that that's gotten a lot of media attention, but also maybe personal experience might be in there too. In your practice, do you see that as a big problem?
Well, I think there's drug abuse in terms of children's experimentation with substances and whether or not they end up becoming problem users or addicts. But there's also the concern of adult and parental drug abuse and how that's affecting our communities. So, you know, the concerns around opioids and heroin addiction currently in the New England area is something that we definitely see as a major problem. But it's interesting because although these are concerns for child health, I think the drug abuse issue is one that really reflects the importance of adult health and how that influences child health as well.
Because I looked at that and said, to me, drug abuse is such a huge issue, not so much, well, it is in kids and adolescents and such, but in the families and the profound impact that it has in a family.
Right.
So it's definitely a big problem for us. Yes, go ahead.
You know, I think the drug abuse question also brings the broader issue of mental health, which is one of the things that I didn't see reflected on this list.
Right.
So it's depression, anxiety, other types of mental health disorders, both within families and for the children themselves, I think all reflect problems related to drug abuse. We know these tend to cluster, and so I think they're linked. I was just surprised that we didn't see mental health on the list.
So going along that same line, these are what we see that parents and adults think. What do pediatricians think? What do they think are the big ones? And we can elaborate on some of those too.
Well, I think, as you well know, the top 3 issues for children are accidents, and particularly unintentional injuries, motor vehicle accidents, and unfortunately for youth, suicide. So those are major issues that were not reflected in the poll.
May not have been offered, but also nobody brought them up. So I think the other issue too that we spend, that as pediatricians that we see a lot, even though, and it crosses all practices, is poverty. In kids in poverty, I think the latest across the country is that 25% of our children are living in poverty conditions, and the impact that has on their health, mental health, on their well-being, and how they come as productive adults.
That's a hugely important risk factor for many health problems. I think, you know, we tend to look at specific health outcomes and specific concerns that we have, and we don't tend to think about what are the fundamental root causes of these many, many problems. And you just said probably the most difficult issue facing families and communities today is the stagnant wages, the fact that we have not seen an increase in although we see unemployment rates are reportedly down, the fact is that wages have not increased. We have more of a gig economy, so parents are struggling more to be able to have stable routines for their children, and their actual incomes are not increasing. So I think these are huge risks to children. And as you and I know, fortunately, those are things that we all need to address as a community, that we can't, as pediatricians, write a prescription for or help with a quick fix, although we sure would love to.
Right, and I think just that we recognize it, and whether you actually bring it up or not is probably not the best idea, but understand where a family is coming from when they're facing things that are just something that we can't imagine. Some of the other things you had mentioned, mental health in particular, that for me is huge on my list, and I think it is on other lists. So what, again, going back to your practice, where do you see that fit in? Well,
this is different depending on whether or not you're an adolescent medicine person like I am, or you deal with infants and young children or school-age children. But mental health is an issue for children across the board. I think in the school-age children, we're looking more at issues around behavioral and conduct disorders and ADHD.
So ADHD is?
Oh, sorry, attention deficit hyperactivity disorder.
I think most people know what ADHD is, but okay.
And also concerns about autism spectrum disorders, which are on the rise. And then in the adolescent group, we see the onset more of mood disorders, things like anxiety and depression. And also in adolescence is where we see sometimes the onset of some very severe mental health disorders like schizophrenia. So mental health is really an important issue. Stress made it onto this list.
It did, yes.
Which is important. Stress, but stress and mental health are not synonymous.
Right.
And in fact, we know that some stress can help children grow, can help them stretch and reach for things, but it's that idea of toxic stress. When you're too much and you get overwhelmed, then that can lead to problems, mental health problems, mood disorders, substance use disorders, and other problems.
And I think you bring up a really good point as far as the toxic stresses, as the Academy of Pediatrics has coined that, and also and we had talked about this before, adverse childhood experiences. So just to clarify on that, what that means to me is a child is in, whether it's a poverty situation or whatever, if there's domestic violence going on, if there's drug abuse going on, if there's chronic illness of any kind going on, that shapes a child from the time they're born. Absolutely. And I think that it really makes such a difference. And not that we just realize that, but I think we're trying to get that message out that if there's somehow you can change or make better or stop that spiral of getting out of control, it would be so beneficial to the children. So your thoughts on the adverse childhood experiences?
Well, I think those are all reflective of the issues of poverty and disenfranchisement and economic stress that we are facing today. Yes. So, but those things will cluster, I think, in disadvantaged communities because there's greater risk for those families and they have less resources.
So another topic that we had talked about that actually has a broad spectrum from infancy up until adulthood is sleep. And people don't think about that very much, but personally they have probably had problems with it or with their children. So what do you think about that?
Sleep is one of these things that just seem to hit the stage in the past few years, and we are really realizing how critical it is and how it affects everything from your physiologic functioning, your weight status, your mood, and how you grow and develop, how happy you are. I've been really surprised at the tenacity with which particularly teenagers do not want to sleep, even though their bodies really need the sleep. And some of the issues reflected here, like the internet safety and the sexting, reflect also this issue about screen usage and our ability to be on these screens and doing things all day and all night, the social media connections that kids have where they feel like they cannot disconnect, the sleeping with the cell phones under the pillow.
And many of them do.
And many of them do. And I think maybe one of the reasons we see these reflected as concerns is because adults who are parents are also stressing about how to negotiate those things with their children. It's much harder to take away a cell phone than it is to get a computer or a television out of a kid's bedroom. So these screens have gotten so small and they have become such important parts of kids' lives. They're getting integrated into schools and into learning. So the boundaries are being blurred, and I think this is a very important area for us to figure out in concert with parents, children, schools, and pediatricians to work on how can we get everyone on the same page around what's a healthy sleep routine for children.
And I mean, I see kids I'm primary care, so I see them all ages, and of course it starts from that very first visit when they come in with their 1-week-old or 2-week-old. The biggest thing they complain about is he doesn't sleep.
Yeah.
Or he doesn't sleep enough, and they're looking exhausted and such, and I'll say, just give them a chance, and you try to walk them through it. And then it becomes more like we call, you get into toddlers, you get into just these fights with your kids about getting them to go to bed and getting them to be in bed, staying in bed, not being, somewhere else sleeping. And so it's a huge issue. And a lot of parents don't want to bring it up because they think they're doing something wrong.
Yeah.
And I think it's a big question that we as pediatricians ask at every single visit. How does she sleep? And interesting answers. As you mentioned for adolescents, I know they're going to miss that life-changing text at 4 o'clock in the morning if they don't have that phone right next to their ear while they're sleeping or not sleeping. And it is a big issue, and you're right, it's just tough to get that out of there, but it just takes some discipline, which is very difficult for many families. So
I think the fact that many schools are looking at these later start times for teenagers, that is helpful, but that doesn't mean that it's okay to keep letting them stay up later and later and later, because really the amount of sleep that children needs tends to be more than they're getting, even on a good day.
The other thing to pick up on the adolescent sleep issue that I hear a lot is they have to get up to get the bus at 7 o'clock or earlier in the morning.
Right.
And so they, during the weekdays, they're not getting a whole lot of sleep, and then the parent will tell me, well, they make up for it on the weekend. And what they're doing is on Friday and Saturday nights, they're going to bed at 2 or 3 in the morning and sleeping until noon, and then when they go to bed on Sunday night, they can't fall asleep for anything.
Right, and then they're behind.
And it just blossoms from that.
Yep.
So it's very hard to say, you really got to try to go to bed at the same time.
Right.
And get up at the same time, which most adults don't do, but that does help if you can get them to do that. Let me look at a couple of the other things that we had talked about. You had mentioned the developmental piece that we had talked about earlier. Can you elaborate on that? How we had said a little bit about it, but the difference between the problems that would ensue depending on the age of the child.
Well, as pediatricians, we spend a lot of time with families, as you all know, doing anticipatory guidance, helping to anticipate what's going to be coming up for the child as they grow and develop and learn new things and take on new abilities. So when you have a 6-month-old who's sitting but isn't moving anywhere, you don't have to worry about them getting into the dishwashing detergent, or the laundry. But as soon as they start crawling and wandering around, so those sorts of issues around accidents and injury and the ability to prevent them, I think for young children starts very early on. But then questions about types of infectious diseases that we might see. One thing that was not on here was any kind of infection, but I know that parents of young children, when they get a high fever, when they're cranky and not feeling well, that's a huge health concern. People are very concerned about vaccines and the issues around vaccinations. That also didn't make it on the list. So vaccines and school entry, that's an issue that comes up developmentally.
Yes.
And then the issues around more the adolescent behavioral issues that come into play in terms of the sex, drugs, and rock and roll piece. One thing we haven't talked about that did make the list is the smoking and tobacco use. And it's been very encouraging that many communities are raising the tobacco age for tobacco buying to 21.
Yes, yes.
And we saw the FDA recently, this week, regulating the sale of R.J. Reynolds tobacco products in terms of highlighting that those high in menthol, and that sweet flavors that kids particularly take up, that they are taking a hard look at this and they're going to be blocking the sale of those.
Yes.
But it's been sad that we are still dealing with the issue of tobacco products in children, because we've known that this is a problem for decades now. We just can't seem to crack that nut. So,
well, the tobacco companies have cracked it by offering the liquid nicotine.
Exactly.
So that's, and I mean, when they market things like that, and it's bubble gum and gummy bear and that sort of thing, I don't think they're really marketing it that much to adults. So for us, this is another big issue.
Yeah,
yeah, go ahead.
Well, I think people think of tobacco and cigarette smoking as sort of old news, but it's not.
No.
It's a huge, I think it's the #1 cause of preventable death still, is tobacco. So I'm really glad that made the list, because it is important for all children, and to realize that some children start these products, as you said, very young. So we have to keep an eye on that one.
And then of course there's the secondhand smoke to that point too, which is actually a concern with the liquid nicotine and the e-cigarettes and that sort of thing. So now when I ask a patient, and I start asking it around 9 or 10 if they smoke, now I also have to say, because they'll say no.
But they
and
do vape.
do you vape? Right? Do you vape? And they'll go, oh yeah, and they can stand outside the school door and vape, and I'm thinking, wow, that's quite interesting.
The other concerning trend with this is the hookah trend for the older kids. These hookah bars that are coming out, that people seem to think that because the smoke is passing through water that it's perfectly okay, and yet the dose of nicotine that you can get from these is really huge. So that's another area where we want to make sure excuse me, that families and young people know that that is dangerous.
Yes, it is, and addictive.
Exactly.
So I think that's, again, for us, and it was, I agree with you, it was nice to see it on here. And another thing that we had talked about previously was what you had said, the 24/7 culture. So we had talked about that a little bit, about the immediacy of the phone, but I think it's more than that too, don't you?
Well, I think some of the issues on the list don't reflect the fact that we don't have time to settle down. The sleep part that we talked about is also related to this, that we don't have time to take a breath and be in the moment. And kids need that downtime, that unstructured kickback time, and parents need it as well. Adults need it. We all need it. And I think when you miss that, you will see that reverberated in mental health problems, in injuries, and people being distracted and not being able to do things well, or missing something, and that's when you can see health risks rise. So I think that's one of the underlying issues as a society we need to think about.
And I think too, this is where the adults play a huge role in modeling that behavior.
Absolutely.
So you'll be at a restaurant and there'll be a table with maybe 3 or 4 kids and the parents, and they're all on their cell phones.
Right.
They're not looking at each other or talking to each other. They're all, whatever it is they're doing, on their cell phones. So, and it's that type of behavior that the kids learn by what they see and what they hear.
Yes.
So I think that's, and again, that was one of the things that we both thought was a big issue. And then lastly, and we had touched on this, the other one that we had mentioned was violence, just violence in general. So I know, certainly suicide, accidents, guns, big thing as far as just what's going on in the community. It's gun safety that we're concerned with, making sure and asking that question. Do you have a gun in the house? That sort of thing. So when I look at violence, that's a question that we often will ask and see what's happening with that.
I think that's a critical question.
Definitely for
if you have a gun in the
families.
house, it's got to be locked,
Yes.
and the ammunition has to be separated.
Yes.
From.
So Liz, you mentioned earlier unintentional injuries, which is the #1 cause of death and certainly injury in kids. Can you elaborate more on that, please?
Well, as you said, unintentional injuries for all of the children's age spans, so either infancy, early childhood, middle childhood, adolescence, it is the #1 cause of death. So for pediatricians, that's what's first and foremost on our mind often.
Yes.
And that's why we tend to talk to parents and to talk to children about how they can help keep themselves safe.
So what kinds of unintentional injuries were you thinking of?
Well, unfortunately, one of the big ones is motor vehicle accidents. So that is not something that anyone plans, but it's a huge cause of morbidity, of illness and problems for children. And wearing seatbelts is very important, so we want to make sure that children have car seats when they're of the age, have car seats, and that they always wear a seatbelt. If you have a young driver, you want to make sure that you're teaching your drivers to be safe and you're doing really careful guidance of them when they're learning how to drive, and you're following the laws in terms of making sure they don't have more children in the car than they should when they're an early driver. So that's a big one. I also think in terms of poisonings is something that, no parent wants to have their child get into a substance that they shouldn't be taking in, but kids are quick and parents don't realize how quickly they can find their way into things. So that's another issue that we often see that is a problem.
Well, this is hard to believe, but we are almost at the end of our segment for today. And I wanted to ask if you had any closing thoughts or any other issues that you'd like to bring up in just a few seconds?
Well, I think it's really important to recognize that kids basically need, I think, three things. I think they need stable, nurturing relationships. They need healthy nutrition, and they need safe, supportive environments. And I think the concerns that we see here reflect when those things aren't there. The other quick thing I'll say is that these are all health risks, but don't forget that health can be very positive. There's a whole positive side to health, having a strong identity, civic engagement, knowing who you are, a sense of purpose and meaning in life, and that those are important health issues for kids that we don't see reflected on the poll.
And I think if you give them the strength, give them the tools to learn how to deal with that some of the stresses here and some of the issues here are, they're not going to go away, and they're going to need to learn how to deal with them. Absolutely. Right. Any other thoughts at all before we close?
Okay. Thank you very much for the discussion.
Well, thank you very much for your expertise, and thank you for all of your information tonight. It has been a very delightful conversation. If you need more information on children's health and the issues we discussed in today's program, visit our website at physicianfocus.org. I'm Dr. Linda Young. Thank you for watching.
I'm Dr. Elizabeth Goodman. Raising a happy, healthy child is every parent's priority. When your child has a fever or is injured, it's easy for parents to seek medical attention. It's not so easy when kids don't want to do homework or engage at school, are withdrawn or cranky, and tough to connect with, all of which could be normal or could be signs of mental illness. Mental health problems such as ADHD, depression, and anxiety are common among children and youth. In children, these problems often look different than they do in adults. So it's important that parents be aware of warning signs that can indicate mental health problems. Look for relationship problems with peers or family members, trouble fulfilling responsibilities like homework and daily chores, a drop in school performance, or mood changes that last for weeks. If you observe any of these signs, talk with your child's pediatrician. For more information, visit the American Academy of Pediatrics at healthychildren.org.
I'm Dr. Michael Hirsch.
I'm Dr. Bob Segi.
Deaths and injuries from firearms continue to shine a spotlight on gun violence as a public health issue.
The health risk of guns to young people is especially alarming, as firearm violence has become a leading cause of death and injury for children and teens.
Guns in the home raise special concerns because they significantly raise the risk of homicide, suicide, and unintentional shootings.
More than 1 in 3 homes with children under 18 now have a gun. If your home has a firearm, we urge you to take precautions to protect your child.
Store guns unloaded and locked in a safe with ammunition locked separately, and make sure the homes your child visits are safe as well.
For more information, visit the Massachusetts Medical Society for a copy of Protecting Your Child from Gun Injury.